Mr. Fletcher, class, hello. My name is Keith Ferguson, and today I'll be giving you a demonstrative speech. What I decided to do my demonstrative speech on was the application of a improvised pressure dressing. The reason I decided to do improvised over a commercial pressure dressing is because in the first aid kits that you find at school, at your workplaces, and even in your vehicles, those usually do not have commercial pressure dressings. Those are usually made of, they have gauze in them, they have tape, and just with those two instruments, those two tools, you can create a good pressure dressing that will be effective as well. Another reason I decided to do a pressure dressing was because in today's day and age, you never know when you're going to be called upon to provide aid to somebody or to yourself. You could be in a wreck. There have been many mass shootings in the past as well where people could have provided aid to other people. So it's always good to have this kind of information. So what we're going to go over is what to look for to place a pressure dressing versus a tourniquet or to leave it open. We're going to go over the types of bleeding that you would put it on. We're going to go over the application of it as well. So I'm going to take you down to the ground so I can better show you how to do these things. So the first thing you want to do is you want to look for bleeding. So say you have bleeding on the pants and you see that there's blood there. The first thing you're going to want to do after you see bleeding is to expose that wound. So you can pull the pant leg up, you can cut the pant leg, whatever is easier for you to do. I'm just going to pull it up because I don't want to ruin my pants. You can pull the sock down, and if you can see it, I have written on me, this is like a laceration that I've put on here. So when you see that wound, the next thing you want to look for is what kind of bleeding is occurring. So if you just have oozing blood, so blood is coming out, but it's not spurting out, but it's steadily coming out, that's something that you would want to put a pressure dressing on. However, if the blood is squirting out and it's pulsating and it's squirting everywhere, that's something that you might want to put a tourniquet on. I don't have time to go over that in this video, but if you have any questions about that, please feel free to contact me and we can go over those things as well. So I see oozing blood and I see a large laceration on my leg. So I'm going to grab my first aid kit. This first aid kit actually came out of my vehicle. I'm going to open it up. Now, if you are working on someone else and you're not working on yourself, the first thing you're going to want to do when you open this up is to put your gloves on, because you don't want to cause contamination or anything like that. And there are gloves in here. It's a little pack of gloves. However, I'm working on myself, so I'm not going to use gloves because it's easier for me to manipulate things without gloves on my hands. So the next thing you want to do if you're working on yourself is grab some gauze. We've got a wad of gauze right here. Now you don't need to do anything special with this gauze. If you have a wad of gauze, then just place it directly on that wound. So you've got that wound covered and it's not going anywhere. The next thing you want to do is you want to grab some tape, which we have right here, and start taping this gauze to the appendage. It could be your leg, could be an arm, something like that. Another thing you want to look out for is that this gauze is covering the wound entirely, right? So if I had the gauze like this and I had that little piece of wound sticking out, that wouldn't be correct. What I want to do is make sure that the entire wound is covered, because otherwise I risk not putting pressure on the entire wound and it bleeding in some other part, and then I'm not doing the job correctly. So I've got some tape. First thing I'm going to want to do is just secure the bandage onto my leg. So I'm going to take it. I'm not going to wrap it all the way right now. I'm just securing the bandage to my leg. That's all I'm doing so that I can have both of my hands to work with. Now that I've got that on there, I'm going to want to apply some pressure to it. So what I can do is take this and wrap it all the way around, and then pull it tight to the skin and to the bandage and put it on there. Make sure that there's some pressure on there. And I'm going to do that another time just to create more pressure. And I'm probably going to do it one more time at the bottom as well. So the best rule of thumb, the best practice to use is to go one in the middle, one on top, and also one beneath. So I've got this. I'm doing one more on the bottom of it. And what you can tell the person, or if you're doing it to yourself, what you can do is, since it's secure, put pressure on it yourself. Push on that and make sure that there's pressure on it at all times. Make sure that it's stopping any bleeding. If you see any bleeding coming out from the bottom and it's still oozing and stuff like that, you can take this bandage off and try to reapply another one. And if that doesn't work, again, you're going to have to go to a tourniquet at that point, which is something that I will go over in another video if I get the opportunity. If I don't get the opportunity, please feel free to contact me. I can go over any of these things with you on a one-to-one basis as well. But that is how you apply an improvised pressure dressing. Again, if you have any questions, please feel free to contact me. Thank you.